So hello, I'm here with another, I guess, exhibitor, or do you have a stand?
No,
here?
I don't. No, I don't believe in stands, Andy.
That's fine. So another a networker, a best practice conference in Birmingham at 2024. So we've been here talking to people on the floor, seeing who's at the conference, what they're here for, and I've just met Georgina. Now, I'm looking for some solutions to how we can affect and improve cardiovascular disease outcomes at scale. That's one of the questions I've come to the conference with. And you had some ideas about how we can do that. So do you want to introduce yourself, Georgina, and say what you do?
Sure. Yeah. So I'm Georgina Craig. I run an organisation called the Experience-Led Care Programme, and we are focused on building and spreading person-centred solutions to big challenges around population health. And I've been working since 2015 to develop and spread the group clinic model, which is a way of seeing patients, but where instead of seeing patients one-to-one in an appointment, you see them in a group. And I'm really pleased that we've met each other today, because I do feel that the group clinic model could be really powerful as a way of improving cardiovascular disease. And we were just saying that what's fascinating to me is that I'm in my late 50s now, and I've got friends who have got sort of pre-diabetes. I've got friends who've got high blood pressure. I've got high blood pressure myself. And actually, when I work with teams to do group clinic models for diabetes or hypertension or whatever it is, it's the same biometrics that are coming up. So we're looking at HbA1c, we're looking at blood pressure, we're looking at cholesterol, we're looking at the risk, Q risk. Yep. I'm not a professional.
Q risk 2 or 3.
Yep. I'm not a clinician, so forgive me my sins. It just strikes me, why are we doing this as a separate review? If I was in the room with people with diabetes, I would be learning about how to manage my diet around insulin resistance. They would be hearing around blood pressure management. So my sort of challenge to you, or my kind of opportunity that I think we should really look at in Nottingham City, is look at your cardiovascular strategy and work with the community, i.e. patients, but also your hospital people, your community services, primary care, the voluntary sector. Bring them all together and look at how can we use a group approach to help us to improve cardiovascular outcomes. And that would be in the medical environment, in using group clinics, for instance, but also, how can we kind of galvanize people so that they engage with things like park run, or start working together to lose weight, or maybe if park run's too much, let's just do a walking group together, or whatever.
So Georgina, I think we may well accept your challenge. I'll go back to Nottingham and have a chat to people there. So just some follow-up questions really. We're here at Best Practice. Are you having a good time, and how are you finding the conference?
Yeah, I'm running 2 sessions. So yesterday I did a panel on personalisation and group clinics. So how can we use group clinics to improve personalised care? Mm-hmm. And today I'm doing one on how group clinics can help us to improve menopause care. So I'm busy doing that stuff. And I do love Best Practice, I'm not going to lie. Every time I come, I feel really energised. I get to meet, for the first time, people like yourself, and it's just, virtual is virtual. It's very helpful, when you work for yourself. It's nice being able to work from home and not having to travel, but there isn't really anything like being in the room.
There's nothing that really replicates this, is there? And actually, it's even more valuable now we spend so much time on screens.
It really is. Yeah, definitely.
Final question, Georgina. When you look at the future of general practice or primary care, is there anything that particularly excites you, or that you think is a big opportunity going forward?
Well, I spend my life literally devoted to spreading group clinics in primary care. So obviously I'm going to say that. And I'm very hopeful that now that we've maybe started to make some progress with the front door of general practice, as in total triage and all that kind of jazz, that we can start to focus in on the people who really need support to keep themselves well, so we generate less demand that way. And to me, the group clinic model is the solution. I'm not going to lie. I'm not expecting every GP practice to do it for every patient, but I reckon 50% of planned care in general practice for long-term conditions at least could be delivered in group clinics, and that's my ambition.
Good. Here. So that's probably a good place to stop. But if people do want to know more, is there any way that people can find you? Or
yeah, so we're online, obviously. We've got a website. It's www.elcworks.co.uk, and you can go onto our website. We do monthly webinars which are free for you to come along and hear people talking about how they're using group clinics in general practice, in other settings as well. We've even got 2 masterclasses coming up which are about how to get going with group clinics, how to make a business case in your PCN. It's all on the website, and that is all for free.
Oh, fantastic. Good. Right, well, let's wrap up there. Thank you very much for speaking to me. Thank you. Bye.